Hello everyone, I'm Deborah Garlick from Henpicked Menopause in the Workplace and author of the book Menopause, The Change for the Better. Thank you very much for joining us today. Our session's about what you need to know about mental health or menopause and mental health. And I'm delighted that Dr Shahzadi Harper is back and joining us today. It's something that we talk about all the time, isn't it, Shahzadi? And I know that it's something that you're very, very passionate about. And when you think about it, it's something that a lot of people have no idea around menopause and mental health. And I know in your practice, the Harper Clinic, you're about holistic health. So starting from the beginning, of course, we all know the average menopause age is 51. But a lot of people don't realise about the perimenopause, which is the years leading up to menopause. And that's when symptoms can start. And I know that's what we were talking about earlier this morning, around that very mysterious time when symptoms can start to occur, and a lot of people don't realise that they're there. So I'm delighted that you're joining us. Thank you.
Thank you, and thank you for inviting me back, Deborah. And I'm really pleased to be talking about this subject because mental health and menopause, I mean, they go hand in hand, and yet I don't think many women are aware and know much about it. I often say menopause is not just hot flushes. And that term menopause is often used as an umbrella term, to sort of capture all of those symptoms that women tend to get. And yet, I think the sort of mental health side of things, often women aren't aware that this could also be due to hormonal change. And I think that's why we're here, to kind of raise that awareness and also to explain that, you don't have to just put up with it. There are things that can be done. And I think sometimes there's been a bit of a bad press because those women who do feel this menopausal mood disorder, which is what I'm going to call it, often go to their GPs and are prescribed SSRIs, anti-depressants. And yet they often say, well, we don't feel depressed. It's a different feeling. So perimenopause can start for about up to 10 years or so before your final period. So if we're thinking about as soon as you enter into your 40s, and women start to notice hormonal changes, which may be just that your cycle has got a little bit shorter, maybe you might miss the odd one or two here, but you may also be feeling other symptoms. A big one is not being able to sleep. Often women will talk about falling off asleep, but not having that depth of sleep, and then waking up between sort of 3 and 5, often with some palpitations. Other things that women experience are anxiety. Women who've never experienced anxiety before are feeling, more anxious. Overwhelmed is a common word that's used. That normally the things that they could tick, tick, tick suddenly are overwhelming them, or they don't feel that they can cope as well. And the other aspects are that word finding difficulties. They can't find those words that they would normally flow and sort of get through a sentence. And then that starts to play on their mind. And a lot of women often will say to me, I'm worried that I might be getting dementia. And I don't know where the joy in my life has gone. I don't really have anything to complain about. I do have a good job and financially things are okay. Home is okay. So why is it that I've lost that joy, that sort of luster for life? And, so it's not depression as in what we would call clinical depression. Clinical depression is different. You have consistent low mood over 2 weeks, and you have to fulfill 5 of the DSM-5 criteria, which is what we use in medicine to work out if somebody's clinically depressed. This is different, but it's still impactful and impacts all aspects of her life. So I think it's really important to talk about it, and sometimes talk about this dark place that women can go to and feel really blue and having lost that zest for life. And again, it comes back to those hormonal changes. Particularly estrogen, that we have receptors of estrogen all over our body and in our brain, and it's very much involved in the connectivity of our brain. So often I talk about it as Wi-Fi within the brain. So when your Wi-Fi is down, if you think about when your Wi-Fi is down at home, how frustrated do you get? How annoyed do you get? You're on the phone trying to sort it out, you're trying to get everything connected. And that's how it can feel in your brain. You can feel that things aren't connecting so well. The other way of thinking about it is also a bit like an antidepressant, because what estrogen does is it maintains, keeps those happy hormones that we have, serotonin, dopamine, noradrenaline. It keeps those levels high. So on the days when our estrogen levels are low, those hormone levels dip. And that's why we have this fluctuation in mood during that perimenopause. That's why we feel flat on some days, but other days we can feel happy, bouncy, fine, but then other days we don't feel so well. So it's almost like this whole number of sort of symptoms coming together, colliding in one go. And you're left a little bit flummoxed, because you might be putting it down to your life. You might be busy, children, family, work, home, 101 things. And, currently we've got all of this uncertainty around with COVID, which also feeds into it. So there are a lot of factors going on.
There are, and the psychological symptoms can often be the ones that women are unaware of, start first, and have no idea what to do about them. So it's interesting that you mentioned antidepressants, because that came through in some of the questions. My doctor's given me antidepressants. So what is the difference between antidepressants and HRT?
Well, antidepressants are used in clinical depression or reactive depression, and they are medication which there are lots of different types of antidepressants. I think the one that we commonly are more aware of are SSRIs, they're selective serotonin reuptake inhibitors. So what they do is they prevent the breakdown of serotonin, one of our happy neurochemicals, from breaking down and metabolizing and sort of being flushed out of our body too quickly. So what that does is it helps to maintain the levels of it. And HRT is hormone replacement treatment. So we know that your hormones are declining due to a decline in ovarian function. So I very much talk about ovarian function is very much linked to brain function. And when we talk about brain function, we're not just talking mood, we're also talking about sort of word finding, concentration, focus. So all of those aspects, which we know when people are feeling low, that all of those things happen. So those are two different things. And the NICE guidelines, which are the National Institute of Clinical Excellence, came out in 2015, and they very much say that SSRIs or antidepressants should not be used first line in menopausal mood disorder. One should be considering, we talk about holistic measures, exercise, mindfulness, breath work, looking at lifestyle, diet, cutting back alcohol, caffeine, all of those things that might be perpetuating some of those symptoms, and then considering HRT if we feel that needs to also be added in.
Yes, and we've talked before about techniques like CBT are very, very good. I think as much as anything, and we have those free resources that are available. And for me, some of the CBT is also about us becoming more accepting of what's going on in our bodies.
Accepting and aware. And I think that's the two things, listening to your body and listening to what's going on. I would say you don't have to accept being low. You don't have to accept not having joy or energy in your life. But, this is a process, and we are sort of changing and evolving. And it can be very much a positive process, for a lot of women, once you've got a handle on it. But it's trying to get that handle. But first step is recognizing what's going on, listening to your body, and seeking out sort of the resources and help that you need.
Yes, it's also important to talk to others as well, isn't it? Because I know I've shared my experience. I think I'll be remembered for, or actually probably my fear is I'll be remembered for shouting out random words when people aren't expecting it. So, I shouted out the other day, Tom Hardy. And everybody else had finished the conversation an hour earlier, and I just couldn't remember the name. And then it just sort of comes out like some sort of form of Tourette's. And it sort of makes me think that my relatives and friends are going to think I'm batty. It's just
that happens to all of us. I think that happens to women at these Tom Hardy moments. And I think there's an element of being accepting of that, because we are doing a lot more now than we were doing when we were 20, or, you know, sort of also, you know, we've got a lot more to juggle. And so I think, don't think that everything's going to be 100%, or you're going to be, but you may well have the occasional Tom Hardy moments. You may well go upstairs and think, oh, what did I go up there for? And there will be some days when you feel less energetic and lower in mood than other days. And I think it's learning how to manage those days, and social therapy, you know, talking to others and not isolating yourself. It's really important. You know, you do need to maintain those connections. And often, you know, one of the things might be, if your friend hasn't connected with you, or your sister, or, you know, someone that you know, maybe you reach out to them. You know, I think often we can be a bit too British and sort of hold back and think we don't want to be treading on someone's toes. But, you know, if you feel that that person's not really been around that much, yes, they might be busy, but they could also be in a grayer place.
Indeed. And you mentioned some of the natural techniques, and you mentioned sleeping in particular. Now, I know my brain fog is worse when I've not slept. And we know that sleeplessness is a big problem during menopause. And if you're not careful, you feel like you're in a downward spiral.
Well, sleep's really important from a mood perspective. So, you know, it's almost like a chicken and an egg situation. If you don't sleep so well, your mood's going to be a bit lower. And you know, when your mood is better, you tend to sleep well. So sleep is important for so many aspects of life. And we know that that's one of the things that happens during perimenopause. And often it can be one of the tipping points for women coming in, that they just can't sleep. And you're also irritable, you can't concentrate then. You know, you're hungry, so you end up gaining weight. So, you know, sleep has numerous good, I suppose, you know, good things from being able to sleep well. So we talk about sleep hygiene a lot, talking about don't take your computer to bed with you, don't sit there texting away at night, you know, don't have coffee and tea, you know, too late in the evening. Think about some herbal tea. Think about some breath work, you know, just slowing your body down. And, you know, I'm very much about being realistic. I mean, I've seen some techniques which are sort of 8-7-5, and I've tried personally to do them. And when you're feeling a bit anxious and a bit wound up, to breathe in for 8, hold for 5, and breathe out for 7 is way too much. So I always say, pace yourself. You know, if what you can do is count to 4 when you breathe in, hold for 4, breathe out for 4. If you can do that, then build up to, you know, 5, 5, 5. But take it at your own pace, because, you know, I know when I'm a bit angsty and sort of, you know, wound up, to try and slow myself down to that pace, it's not going to happen in one go. And other things, you know, use apps if you like. I use an app to help remind me to drink water throughout the day, and because I never do it enough. So so I use an app to remind me to drink water. And, you know, sometimes you think, oh gosh, am I a bit of a failure for using an app for a reminder? No, because, you know, there are so many other things to also remember. You know, let's take some of that load off. And one of the things I talk about it is when women say that they feel overwhelmed is, look, you don't have to do all of that list in one go. So I often give them this technique of, look, have a dumping list. Dump everything down, because once it's out of your brain, that might make you feel a bit better. But then just move 3 items into your in tray. Those are the 3 that you're going to tick off today. And once you get through them, you go tick, 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 they go into your out box. Then take another 3 from your dumping, you know, list and move them through. So do things in bite sizes, which are manageable. You know, often it's such a long list, and you then end up going like a, you know, sort of a headless chicken trying to tick off all of these boxes. But actually, you know, you're less efficient than you know, if you had just broken it down into bite-sized chunks. So that's really important to do. And, you know, going back to the mood aspect, exercise is really important, because that releases those happy endorphins. Do things that you enjoy, find a hobby that you like. You need to do something that helps maintain those levels of serotonin, noradrenaline, and dopamine. And we know that exercise, although it's hard sometimes to start it, to initiate it, because you can feel lacking in motivation and energy, the effects of exercise doesn't just last for those 20 minutes. It lasts for a few hours afterwards. And it also improves the brain activity. So it improves your mental sharpness and agility. So it has a huge effect. So if you can just do that, again, maybe download an app, do one which is maybe 10 minutes or 15 minutes, or even just put some music on and dance around the house, that can be really good for you.
Thank you very much. And I'm going to ask my colleague Sally to join and check around questions. I have one here. It says, I have been suffering from anxiety and low mood caused by perimenopause and was signed off work for 6 months earlier in the year. I now take sertraline and tried HRT gel and Oestrogen, but only managed the Oestro vaginally for 5 days, as it made my mood dip massively, and I couldn't stop crying. I've been prescribed Everel Sequi patches, and I'm concerned about the progesterone part of that effect. I know we can't give individual advice, but the key bits that seem to be jumping out there is the anxiety and low mood, and stretaline and HRT, but not being able to. It looks like she's taking the progesterone element vaginally. So,
micronized progesterone, which is utrogestan, can for some women really cause a dip in mood. So micronized progesterone is natural progesterone, so a lot of women want to go down that route. But if you are a woman in the past, maybe who's had PMS or postnatal depression, then you are a woman who probably does not suit the micronized progesterone, the utrogestan as well. And the fact that you tried it vaginally, and even then you felt like a dip in mood. So it's better to go down the route of a synthetic progestogen, which which you do now have in the Everel Sequi patches. Again, not being able to give personalized advice. Sometimes you have to do a bit of a trade-off and that's in life with everything, benefits versus risks. And you've touched upon the fact synthetic progestogens, and breast cancer risk. But the thing is, it's often a trade-off, and it's really about personalized care, individual care. So what I would say is, if you're a fit, healthy person with very little medical risk factors, then going on to a synthetic progestogen, I would say, considering what your symptoms are at the moment, is a small trade-off. But if you wanted to have more advice, on a one-to-one basis, then that's a different thing. But in life, a lot of things are calculated, and we work out benefits versus risks for each individual person.
Fabulous. And Sally, what was your question?
Okay, so we've got a few come in. So we've got somebody asking about complete supplements. So they've said that they're taking magnesium, which they've found to help with sleep, B vitamins for energy and mood, and various supplements for hormonal migraines, but they said they feel like they're rattling, and whether there's anything that could be combined that would, any kind of recommendations around supplementation or things that you think would be of benefit.
So I mean, one of the things is to look at your gut health. Think about probiotics, because we know that the majority of our serotonin is also made in our gut. So I often do recommend probiotics as one of the things that I do, and then just a general multivitamin. Really, I'm not going to say to you. If I was to choose one, I quite like someone to take a B complex, because we know the B vitamins help with mood. They also help with hormonal balance. So that's one of the ones I would always recommend. But as long as you've got a multivitamin which has a B complex in there, then I think that there isn't one specific. And there's lots of price points, so I don't want to be throwing out different brands, because everybody's price point is different. So I would always say a probiotic, because gut health is really important, and then think about a multivitamin really, and do try and do a bit of exercise. 10 minutes of dancing, I do that in my office to break up my day sometimes, and that's probably all that I get done sometimes. So it really lifts mood.
That's brilliant. Excellent. And someone's also said that every time they go and see their GP, that's an issue related to menopause, they only seem to be offering HRT without any other choices. And just really what people should expect from their GPs around alternatives, and actually whether they're, the support that they can give as a GP to other things around supporting menopause.
When you go and see your GP, I think the sort of tools in their toolbox are limited and time is very limited.
Yeah.
So I think that, that's something to bear in mind. So, we've already said we ideally don't want them to give antidepressants for sort of a menopausal mood disorder. And so HRT would be the first line, but there are other things like maybe talking therapies, CBT, that they could potentially offer. And they wouldn't really be offering anything alternative, in the sense of giving you multivitamins, but or sort of highlighting any particular ones. But they would talk about lifestyle, diet, exercise, mindfulness, those kind of things. But I think the biggest factor, when it comes to going to see a GP, is time, and that's limited.
Yeah, absolutely. And another question is around if somebody's already taking antidepressants and they feel that it's working for them, should they be questioning whether they should, if they think their symptoms are menopausal, should they be questioning and thinking about HRT instead, or is it very individual?
It's very individual, and one of the things is, if things are working for you, I would not rock the boat. Unless you've got other menopausal symptoms that you think you might want or need HRT for. And often, if somebody does come in to see me, they're on antidepressants and they've got other symptoms of menopause, I won't stop their antidepressant and just put them on HRT. We'll do an overlap, and then we'll think somewhere further down the line, do we wean off the antidepressants? And one of the other things to remember is sometimes we do give antidepressants for women who can't take HRT for their hot flushes. So you may be getting some benefit from them for your physical menopausal symptoms as well, but definitely don't stop and rock the boat, because when it comes to mood, it's such a fine balance that the time to consider weaning or changing is when life is stable for at least 3 months. That's what I say in my GP world. When things are stable for 3 months, that's when we might sort of tweak and change.
That's brilliant, excellent. And the final one that I've got is around driving anxiety, which quite a few women really report of, they've driven the same journey or they've travelled a lot for their work, time and time again, it's been part of their life, and suddenly the thought of getting in the car and driving somewhere or somewhere they've never been before causes them huge anxiety. And just any advice, and it really seems to be something that seems to be quite a common challenge.
It really is. And even I would say, as a menopause doctor in my clinic, I wasn't aware of how many women this impacted. And I've seen a number of women who won't drive anymore. And they've said the same thing to me. I was a confident driver. I don't know what's happened. And I really can't get into that car again. So this is something that CBT, cognitive behavioral therapy, really helps with, alongside medication, is what I would say. Because it's about retraining and rewiring your brain to get you that confidence back. But often going onto medication really does help to alleviate some of that anxiety, that palpitations. But it may just be that you then need the support to get back into the car. And usually it's always done in sort of small distances. I will usually say to people, go to the top of the road, come back, and have somebody with you that, you feel sort of reassured and confident about. So it's about baby steps until you feel ready to, sort of drive further. But it's surprisingly common. And like I said, it's not in the textbooks. It's not in, any of the sort of, there aren't loads and loads of studies, but I know because I've seen so many women with it. And even that, it took me by surprise.
Yeah, absolutely. And I think it's we see it in sessions that we run, and women say, I just don't understand because I've done this all my life and suddenly I don't feel I'm able to do it anymore. And I think just one other thing that's just come through around word memory you were saying about. So one of the head of midwifery at one of the universities we worked with, she found that she was really struggling with word memory, and so she was delivering a lecture and she couldn't remember the word for a scan. And she was going, the thing that you do to see the picture of the baby. And she was doing a lecture in front of her. And it's just really how to cope with that if you're struggling with it in terms from a confidence point of view.
And that's what happens. Your confidence gets chipped away, even though it's something that you've done for 20 odd years or so. And women and men's brains are very different. For women, it is that word finding memory that goes down, because women are much better at that than men. And women aren't as good as directions as men, and that is from clinical evidence. That's not, just so often I say to people, if he says, darling, we've got to turn right here, listen to him. And if she says, darling, you said this 2 days ago, then listen to her, because that is the way that women's and men's brains work. I think it's a really tough one, when you're standing in front of people and you can't remember. I would just put my hands up and say, you just say, look, the word's just gone from me at this moment in time. But it's that thing that, you put babies in or people in and you do the scan. I think just own it, because I think the more you flounder trying to find that word, I think the more maybe hot, sweaty, flustered you get, and it's going to put you off the rest of your talk. So yeah, I would just put my hand up and just sort of say, look, I'm really sorry, I can't remember it right now.
Yeah.
Actually, that's easier in organisations. We do a lot of training in workplaces, and where it's okay and it's normalised to talk about menopause. It's okay to say, I'm having a menopause moment here, but it's absolutely fine. We've got a couple more questions. I think we've just got 3 minutes, so this will be the John Craven's news round bit.
Okay.
One was around, are there any specialist diet plans for perimenopausal? And I would recommend that you listen to Jackie Lynch's webinar. I'll send you the link to that one, and you can listen to that one. The other one was around sertraline. Is it addictive? Is it an addictive product?
So sertraline is an SSRI, just as fluoxetine is and citalopram is. So, I get asked this, I used to get asked this a lot during general practice about antidepressants, are they addictive? You do have a withdrawal reaction if you come off them quickly. So that's why you have to wean yourself off them. And there are some which are better than others, in the way that your body may react to it. But in the sense of, is it addictive that you have to take it for life, or, and if you come off it, you're going to really suffer. I think some of it is individual. Some people do have more addictive type personalities than others, but on the whole, you should be able to wean off. But you also need to be aware that there are things which are called withdrawal reaction, and that's why everybody has to be weaned off slightly differently and at different rates.
Thank you very much. Now, this one sounds like something that we hear a lot. It was a lady, she says, I've been confirmed low hormone levels from blood tests after several years of perimenopause symptoms. After a real struggle of a year last year, I was given HRT from December by my doctor. My last period was before October, before that August. I had a bleed end of January. First week of March, I ended up in hospital and was diagnosed with acute pancreatitis. Finding no reason for this, the hospital took me off HRT. Since then, I've had no periods. I've also been told I have non-erosive gastroenteritis and erosive, lots of other symptoms.
Yep.
But I didn't have the bacterial infection that normally causes this. So my questions are, could all my health issues be caused by hormonal depletion?
That is I think that's a lot to answer for. I can't really say yes or no, either way. I'm going to sit on the fence on this one because I don't know you. There's a lot going on there. But if you are going to go on to HRT, one of the things I might say to her is use a transdermal method, because, through the skin, because it sounds like you've got a lot of gut issues going on. So you would get better absorption getting HRT going through the skin. But I'm not going to say it's down to all of that. There could be lots of things going on.
But Dr. Harper, this is one of the things that we often experience, that women can be experiencing lots of different things. And trying to resolve one symptom and trying to resolve another symptom and trying to resolve another symptom just feels so really, really complicated, particularly in this woman's case, in that, she had a lot of things going on. And for me, it's around thinking holistically around the whole of your menopause and everything that's going on in your life. And I know, Sally, something that our trainers do a lot of training on is listening to your body, making notes around everything that's going on. And then when you sort of start to look at these are my symptoms and this is what I'm experiencing. Doing your reading up from fact-based information or factual information, reputable sources, including what do you want to do about it? What are the key 3 things that are getting in the way? And as Dr. Harper said earlier, if that is sleep, if you're struggling with sleep, that's got to be one of the biggest things that you can resolve to improve your overall health. But then having mapped your symptoms or thought about your symptoms and listened to what's going on and thinking about what's my personal philosophy in managing this, then it comes down to good conversations and communications with your GP. Just this weekend, while I was out, a woman was saying to me, she said, I have no trouble at all with my menopause. And then around about half an hour later, she was telling me about severe palpitations. And then later on that day, she started talking to me about some gynae issues she had, but she'd had no problems with her menopause. So it's sometimes that people aren't connecting the dots, and that's whether that's us or whether your healthcare provider. Does the doctor that you're talking to understand everything that's going on? Or are you just talking to them about this bit and then this bit and then this bit? So we can help ourselves too with the right preparation and, you know, being really clear in our own minds and bringing it all together for ourselves, I would say.
I think it's also important not to put everything under the menopause umbrella. And I'm saying that as a doctor, you know, don't just think everything's down to menopause. You can still get other illnesses. You can still get other, you know, sort of conditions. So don't just stop thinking about your health because you're just saying, oh, let's blame it all on the menopause. There are lots of things that are menopause related, but you know, there are other symptoms that do sometimes need to be investigated. You know, you still need to go and have your regular mammograms. You still need to go and have your smears. You know, you still need to go and you know, have your checkups and things. So don't dump everything under the menopause umbrella either. And that's why it's important to speak to somebody who sort of looks at all the aspects and joins those dots up for you, I think.
Thank you very much. It's been a delight as always, Dr. Harper, and thank you very much, Sally. And thank you to everyone who's joined us. I hope you found that useful and look forward to seeing you all again. Thank you very much.
Thank you.
Bye.